Hello and welcome to the City of Whittlesea Business Network podcast. I'm your host, Amy Bajada, a member of both the City of Whittlesea Business Network and Business Advisory Panel, but also a proud small business owner based in Doreen. Together with the City of Whittlesea, we're sharing local stories and insights that matter to our community of businesses. We recognise the rich Aboriginal heritage of this country and acknowledge the Wurundjeri Willem clan and Tangarang people as the traditional owners of lands within the City of Whittlesea. This podcast is all about celebrating the incredible stories of local businesses, the people, the passion and the progress shaping our region. Whether you're a fellow business owner, a future entrepreneur or just someone curious about what makes our community thrive, this podcast is for you. Let's get started and connect through the heart of the City of Whittlesea's business network. DPV Health is a not-for-profit organisation delivering exceptional healthcare services to people of all ages. From its support office in Epping, DPV Health supports the community with over 50 services across 20 sites, empowering individuals to live happy, healthy lives. Under the leadership of CEO Don Tidbury, DPV Health has gone from strength to strength, becoming one of Victoria's most respected community health organisations. Don is an accomplished healthcare executive with a career spanning the not-for-profit, public and private sectors across Victoria. Well, welcome, Don. Thanks for coming.
Thank you. It's great to be here, Amy.
DPV Health has such a strong presence here in the City of Whittlesea and beyond. Can you take us right back to where it all started? What was the original vision behind DPV and how has that shaped the way you show up for the community today?
Look, Amy, so to give you some context, so DPV Health is one of North Melbourne's largest registered community health organisations. The organisation started in 2018. It was the merger of Dianella Health and Plenty Valley Community Health. And at the time, two organisations felt that they could better meet the health and wellbeing needs of Melbourne's outer north together. So they formed together. It started at about a $40 million organisation, 500 employees. And then over the last 6 years, we've more than doubled. So we're now trading at nearly $90 million.
Yes.
Huge growth in services for our community, and we've managed to bring all of our people with us, and we've actually grown our workforce by a further 200 people.
That's huge growth. I love that concept of two minds coming together to say this is a better way to service our community. I think it's a really plausible and commendable, I guess, way to do things better. I think that's fantastic. Great growth though. So what inspired you to step into leadership in the healthcare space, and what was it about DPV Health that made you want to be a part of it?
So look, I actually started my career, would you believe, in retail.
Oh.
I'm an accountant by trade, but I originally had a big career in department stores working for some of our major brands in Australia. Mm-hmm. But after a good 15 or so years of that, I decided that I wanted to be able to work in a role where I was giving back more to the community.
Fabulous.
Something where you could really, work to your life's purpose. So I started in hospitals and, had a great career across metro and regional hospitals. But I always sort of was wanting to gravitate to community services because it's really working with people to keep them well and happy and safe in the community, which is what really makes me sleep at night. So the opportunity to work in the community sector, and then with DPV Health, which had so much potential 6 years ago, to really meet the needs of, one of the most diverse and fastest growing regions in Victoria. So that's what's really attracted me to community health and particularly DPV Health.
Was the role that you're in now the first role you stepped into with DPV Health?
Yeah, look, I joined DPV Health as the CEO about 5 months after the organisation merged in 2018. So it was an amazing time in my career and for the organisation. And it's not easy leading a merged organisation, and we had a few things to sort out, and really engaging our people, creating one culture, bringing everyone with us, And then getting all of the sort of the systems and the processes all sorted out to enable our clinicians and our people to do their best work. And it wasn't easy, but it was a fantastic time in my career.
Yeah, and it would have been a great opportunity. I think we take a bit of a misstep when we think that things are too hard or things are too difficult, like the merge. But it would have really been that eyes wide open and that opportunity to improve the systems, ensure that the foundations were right going forward. And having you on board was obviously a great asset.
Look, at the time, the board invested a lot of trust in me, and I was able to assemble a leadership team that was united, values-driven, approachable, and really had a deep connection to their community. And together we were able to galvanise our, at the time, 500 employees and bring them with us to really create one of the highest performing community health service organisations in Victoria.
And there's something to be said to have the same people in the organisation when change occurs. I think there's something in that as well.
Yeah. So I think when I started, employee engagement was only 42% favourable.
Wow.
Over the next 6 months, we took it up to 65%.
That's amazing.
And then we've kept it in the mid-70s over the 5 years, which is sort of industry best practice for healthcare. Yeah. It's not an easy gig working in healthcare, but a lot of values-based leadership and hard work goes into that.
Yeah.
So really, if you want people to perform, you've got to demonstrate that they are valued. You've got to listen to them. You've got to act on their great ideas and their concerns and really get their voice into where we're going and how we're going to get there.
Motivation by communication, right? If everyone's going along for the drive, they really should be part of that. And I think it's really great to hear that even though you have excess number of employees, than like such a vast number of employees, that's still a value and it's still so important to not lose sight of that part.
Look, leadership, in my mind, is about making time and space for people.
It's brilliant.
So I'm out visiting sites every week. I write to our people every Friday. I'm got to write my email this afternoon. And with that, I always talk about some of my site visits and, the great work that I'm seeing, what people are telling me. And it is that sort of, we are the sum of the relationships we have.
100%. Yeah, and that connection is so very important. And even just to demonstrate to them that there's still people at the top, let's call it, that are still very much concerned about what's going on.
Yeah. I mean, look, it's not a chore because I love it. I love people.
Beautiful.
And I'd much rather be out there talking to people than sitting in an office or something.
Yeah, well done. You're leading in a purpose-driven organisation, which you've mentioned, which can be incredibly rewarding, but also really challenging. So how has your leadership style evolved over the years to stay true to that purpose while navigating this growth and change?
Look, that's a really good question, Amy. Look, it's no secret. It's not an easy environment in healthcare at the moment across the community and acute sectors. I think, I started as an accountant. In retail, very numbers, profits, P&L, return on investment focus. So that's where I started. But I had some fantastic career mentors over the years, which enabled me to change my focus to people over the dollars. And I think if you lead people, if you lead them well, if you engage with them, if they come on the journey with you, if they're invested, then together we'll achieve all the organisation's objectives. And that's where real high-performing organisations come from.
Besides your weekly communication, what other key components have you seen that has really changed that connection with the people you work with?
So at DPV Health, we put a lot of work into creating a culture of inclusion, where people feel valued and safe and included, regardless of the country they were born in, their gender, where they live, whether they have children, whether they don't. And a great example of that are our cultural inclusion days.
Yes.
So during the year, we celebrate the end of Ramadan.
Right.
We celebrate Greek Easter. Earlier this week, we had a celebration for Diwali, which was on over the weekend. We celebrate the footy finals because that's another big cultural celebration.
Certainly.
And we celebrate Christmas. So they're the big cultural days, but we also acknowledge normally in special communications or other people's cultural days of celebration too, because we are such a diverse community and we want people to feel welcome and included. And we receive wonderful feedback from our teams and people regularly writing to me saying, this is the only place I've ever worked at where my culture or my religion is acknowledged.
Wow, that's fantastic.
So yeah, big focus on inclusion, and it has certainly paid off.
A lot of our listeners are small business owners, and leadership's a big topic for them too. What lessons or principles from your own leadership journey or those around you, like your mentors, do you think really translate into their world?
All right. So the biggest piece of advice I can say is make time for people and make the effort to connect with them. If you demonstrate to people that they really matter, that you have care and concern for them, they will come on the journey with you.
Yeah.
Now, you can also, support them by investing in them, giving them opportunities to contribute, to grow and to shine. Listening to people and following up on any concerns promptly, circling back to them, that builds enormous sort of social capital. Celebrating the great performers, regularly saying thank you, regularly reviewing the performance of how the team or the organisation is going, bringing them with you, seeking their input into how we're going to achieve these objectives. Putting all that together, that's the secret sauce.
Yeah, and I think it's even at a small level. Like I've seen this when I've spoken to business owners myself, that sometimes it doesn't get forgotten, but sometimes there's this perception that I'm not a big organisation, so I don't have to have those 360 reviews and those sorts of things. So it's really great to hear that your advice is that they still matter, even at a smaller level, I think.
Look, the policies, the processes, the performance reviews, they're all important, but making time for people, taking the team out to breakfast, celebrating the great wins, following up on their issues, talking through the results together and how we can improve it, that's where the magic is.
Yeah, and giving them the confidence and that comfort to be able to even table some of the bigger issues that they're feeling, I think is really important too.
And I think that speaks to the concept of cultural safety.
Yep.
Where people can contribute, they can speak up, they can raise issues without feeling unsafe. I mean, that is the bare baseline. You've got to get that right, but then it's everything else I've talked about to build on that.
Yeah, I was actually going to say, building that culture of trust and accountability is something that every business, whether they're big or small, has to get right, I think. How do you approach that at DPV even further to what you've said, and what advice would you give others to do the same from that perspective?
So, the concept of trust is critical. And we cannot expect trust. We can only, as individuals, demonstrate it. And if we demonstrate trust, then people will give it back to us.
Yeah, sound advice.
So that's about we as leaders role modelling. I sound like I'm preaching here, but
no, it's great.
That is about we as leaders demonstrating and role modeling, the above the line behaviours, the right values all the time, not 70% of the time, but all the time. And then we as senior leaders bringing people into the team who also have the right agenda, the right values and the right behaviours.
Yeah.
And it's the behaviours that are critical because, everyone thinks they've got wonderful values, but it's getting the right behaviours day in and day out. And that's another part of the secret sauce I've talked about.
Definitely.
So then tying that with the right behaviours are around shared goals,
yes,
fair and reasonable key performance indicators, and then good reporting to the team that's timely, that they can access, and then really celebrating the big wins.
I'm glad you said fair and reasonable key performance indicators because I think it's got to go that 360 approach. Like it does have to tie in. So
and let's be honest, we've all had times in our career where we may not have had fair and reasonable ones ourselves.
That's right.
So let's treat people like how we want to be treated.
100%. And I think you'll move the needle a lot sooner. I understand DPV Health has grown significantly over the years. How does DPV Health manage growth?
Look, so we manage growth in quite an inclusive and systematic manner. So our services growth is planned through our DPV Health Clinical and Community Services Plan, and our sites are guided by the DPV Health Master Plan.
Wow.
These documents were built over the last 3 or 4 years with input from our industry partners, so from local government, from public hospitals, from the state government, but also from our people and our community stakeholders. So they then plan the evolution of our services and our sites over the next 15 years. But every 2 years, we do a check-in with the plans to make sure we're operating on the most current data and information. And they're really the engine rooms that plan our service growth. But look, when you look at, this fast-growing community that we have, it's no secret that we're planning for service growth in supporting children, in supporting the aged, in supporting people in crisis, so people who may be homeless or victims of crime or experiencing family violence or living with mental health illness. So that's really our focus for the next 5 years.
Wow, that's amazing. As our local communities keep growing and becoming more diverse, what's next for DPV Health?
Yeah, so look, we've got some exciting things in the pipeline. So with Melbourne's Northern Growth Corridor, one of the fastest growing areas in Victoria, we will continue to grow services for the people in the groups I've mentioned. So children, people living with disability, people living with chronic disease, people living with mental health challenge, people in crisis, and seniors in our community. Recently, we've opened new dental services in Craigieburn, a new early childhood and youth service in Wallen, and new adult disability services in Whittlesea. Over the next 18 months, we've got new sites opening. We've got our new integrated primary care centre opening in Craigieburn.
Yeah.
And then we have our new flagship site opening in Epping, in the heart of the city of Whittlesea, directly opposite Northern Health. And our Epping flagship site will include a new GP clinic, Victoria's largest community-operated dental centre, mental health, and a whole range of healthcare and community programs to support everyone in our community, but particularly those most in need.
Such an exciting time coming up, for sure.
Now we've got a big couple of years ahead.
Yeah, I bet. Now we're going to shift gears a little, Don. It's all here in the city of Whittlesea, and we want to hear what your favourite local gems are, your go-to guide, if you will, the local businesses you wouldn't hesitate to recommend here in the city of Whittlesea. So no overthinking, just some gut instinct. Ready to go?
All righty.
All right.
Okay, favourite experience?
Yeah.
The Plenty Gorge. Walking through that. That is beautiful, stunning.
Yeah.
Favourite restaurant?
Okay.
I'm going to say Farm Vegano.
Oh, yeah.
It's stunning.
Stunning down there.
Beautiful Italian food, lovely outlook onto the Plenty Gorge. And then my favourite cafe will be Nina's Cucina, which is based at the foot of DPV Health's head office. And Luke and his team there run an amazing business. Again, it's more local Italian catering. It's the best coffee in Epping, and I just love those guys.
Well, you made that easy for me. That was fantastic. Thank you for the shout out there. Thank you so much, Don, for sharing your story and shining a light on the incredible work that DPV Health does in our community. Hearing how you and your team create inclusive, culturally safe spaces and build trust through collaboration is really, truly inspiring. Your commitment to helping people live happy, healthy lives shows the impact that purpose-driven organisations can have when they put people in the heart of everything that they do. So thank you so much.
Amy, thank you for making time for me today.
Yeah, of course. Whether you're looking to build your leadership skills, capability within your team, or looking to grow your influence, the City of Whittlesea Economic Development Team has got the connections to the right people, programs, and resources to help you on your leadership journey. Let's foster strong, confident leadership that drives positive change across our community. If you'd like to follow DPV Health or learn more about their business, you can find them on Instagram and Facebook and at their website www.dpvhealth.org.au, and we'll also include all their details in the show notes. Next time on the City of Whittlesea Business Network podcast, We'll be meeting with Joanne Caruso from Joanne's Temple Colonics and Wellness Centre. I'm Amy Bajada, and it's been a pleasure hosting you today. If you enjoyed this episode, please consider sending us an email at business@whittlesea.vic.gov.au. We love hearing what resonates with you. The views and opinions expressed in this episode are those of the speakers and do not reflect the official position of the City of Whittlesea. Information is accurate at the time of the recording. This podcast is for general information only and does not constitute professional advice. For professional advice, please consult a qualified practitioner. Thanks for listening, and we'll catch you next time on the City of Whittlesea Business Network podcast.